Good afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. Today we'll be hearing from Dr. Jennifer Russell as well as Minister Dorothy Shepherd of Health. We should be starting in just a couple of minutes. The roll call's already done, so let's just go over a bit of the case count that we know about from yesterday. There were 5 new cases in the province. 1 was in Zone 1, 3 were in Zone 4, and 1 was in Zone 7, which makes for 36 active cases currently in the province. We should be finding out today. I know there was talk late last week when we had revisions to the new orange level about potentially moving back to a new revised yellow level of recovery as early as this Sunday. I'm hearing that Bruce is actually in the conference room, so we should be starting momentarily. So in terms of the case breakdown for now, what we will be hearing from Dr. Russell in just 1 minute. There are currently 5 active cases in Zone 1, 0 in Zone 2, 2 in Zone 3, 22 in Zone 4, 0 in Zone 5, 0 in Zone 6, and 7 in Zone 7. Now again, there was, as you can hear, Harry Forrestal from CBC just joined a bit late, so we're still doing a revised roll call. So we should be starting any minute. But yes, there was a confirmed case of the UK variant in Zone 7. That's the Miramichi region yesterday. Now that wouldn't have been a case from yesterday. That would have been a case from probably a couple weeks ago that was then sent to the national laboratory in Winnipeg. And then when it comes back, that's when they know, when the results come back, that's when they know that there is a UK variant present, but potentially that person has already recovered from the virus. I know they're doing mass testing in the Miramichi region this weekend, and they were doing it yesterday. Just knowing that the variant is present, they're cracking down just to see what else they can find in terms of cases. Obviously, the spread of variants can happen much more rapidly if it gets out of hand. We have seen what happened in Newfoundland, so they're obviously quite concerned about the potential for that happening in New Brunswick. We will be finding out today, though, again, as I mentioned earlier, there was talk late last week, about potentially moving March 7th, so that's this Sunday at midnight, to a revised yellow of recovery, depending on how we did this week. So it'll depend a lot, obviously, again, on the cases we hear about today from Dr. Russell, and we're just a minute or two away from starting, whether that means we will be moving back to yellow at midnight on Sunday. Now, the new yellow, I suggest, if you want to know what it's all about, checking it out on the GNB website. It includes a steady 15, which is obviously better. Oh, I think we are heading to the conference room, so I will join you afterwards. I'll see you then. Please feel free to give me questions on Facebook. I'm following there as well.
Ministre en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shepherd, Minister de la Santé. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Bon après-midi à toutes et à tous. Good afternoon, everyone. I know everyone is anticipating that we will soon be moving to the yellow alert level in our provincial recovery plan. The Playhouse Theatre in Fredericton has put this on their marquee, and I drove by it the other day. It says, "Be patient, we're waiting for yellow." Good things do come to those who wait. La décision du cabinet a été faite au niveau de l'alerte jaune pour toute la Nouveau-Brunswick si tout demeure stable. Et ça, c'était la recommandation de la santé publique. Et ça passerait à la phase d'alerte jaune à minuit dimanche soir. Cette décision du cabinet est basée sur notre tendance à la baisse positive du nombre de cas de COVID-19 qui se poursuit dans ces zones et l'évaluation du risque continue menée par santé publique. Mais je me préoccupe du nombre à la hausse cas actifs dans la région de Miramichi. Santé publique surveille donc la situation de près. S'il y a un changement important au cours de la fin de semaine, Nous reverrons la décision, mais pour l'instant, la région de Miramichi passera en phase jaune avec le reste de la province. Cabinet decided that based on public health recommendations, the entire province of New Brunswick would move to the yellow alert level on Sunday at midnight, with the caveat that everything remained stable. This is based on our continued positive trajectory of declining COVID-19 cases in these zones and public health's assessment of ongoing risk. I am concerned about the rising number of active cases in the Miramichi region, and public health is monitoring the situation very, very closely. There is a significant change. If there is a significant change, rather, over the weekend, we will revisit the decision. We have a lot of test results that will be waiting for the results back. And as of right now, the Miramichi region would move to the yellow phase along with the rest of the province. But again, we're going to be watching very, very closely this weekend with respect to all the testing that's being done and the results of those tests. The new yellow would have more restrictions than we previously experienced during the summer and fall of 2020, particularly with regard to limiting close contacts. These restrictions are required because the COVID-19 virus is still with us and is changing all the time. And as you know, in the Miramichi right now in Zone 7, we did confirm that the variant is there. We got the results back from the National Microbiology Laboratory. So we all must remain vigilant and continue to follow public health guidance and advice. Our case numbers do remain low. We're going in the right direction, and moving all of New Brunswick to the yellow alert level would be a significant achievement. And obviously, I'm very proud of all the work that New Brunswickers have been doing to get us to this point. We literally could not have done it without you. And our case numbers continue to trend in the right direction, but public health is ready to act very quickly when and where necessary. And as I mentioned, we remain very concerned about the new cases in Miramichi, and several of these cases, as I mentioned, are confirmed to be the UK variant of the COVID-19 virus, which spreads much more quickly and easily than the original version. Nous offrons maintenant le dépistage massif aux résidents asymptomatiques de la région de Miramichi. La clinique sans rendez-vous se poursuit aujourd'hui jusqu'à 19h à l'école l'intermédiaire Dr. Lozier Middle School, 124 rue Henderson à Miramichi. Santé publique ajoute une autre clinique de dépistage pour les clients asymptomatiques de la région de Miramichi, au même endroit de 11h à 19h, demain, le samedi. Les tests sont administrés selon le principe du premier arrivé, premier servi. On n'a pas besoin de rendez-vous. Les personnes sans symptômes n'ont pas besoin de s'isoler en attendant d'avoir le résultat, sauf si Santé publique leur conseille de le faire. Et les gens qui ont des symptômes devraient se faire tester dans un centre d'évaluation. Il suffit d'appeler le 811 ou de remplir le formulaire en ligne. We are now offering mass testing for asymptomatic residents of the Miramichi area, and the walk-in clinic continues today until 7 p.m. at the Dr. Lozier Middle School, 124 Henderson Street in the Miramichi. Public Health is adding an extra testing clinic for asymptomatic people in the Miramichi area tomorrow at the same location from 11 a.m. to 7 p.m. These tests are being done on a first-come, first-served basis with no appointment required. People without symptoms do not need to self-isolate while awaiting results unless advised to do so by Public Health. Those who have symptoms should get tested in an assessment center by calling 811 or filling in the online form. I encourage everyone in the Miramichi area to take advantage of this opportunity to assist us in limiting the further spread of the COVID-19 virus. Now, if you've traveled in or out of that area and you have symptoms, I encourage you to get tested also. Aujourd'hui, il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 3 nouveaux cas dans la zone 7, soit la région de Miramichi. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a un nouveau cas. Il y a maintenant 33 cas actifs de COVID-19 dans la province. 3 personnes ont été hospitalisées, dont 2 aux soins intensifs. Today, there are 4 new confirmed cases of COVID-19 in New Brunswick. In Zone 7, which is the Miramichi region, there are 3 new cases. In Zone 3, which is the Fredericton area and the St. John River Valley, there is 1 new case. There are now 33 active cases of COVID-19 in the province. 3 individuals have been hospitalized, of which 2 require intensive care. Please keep all of these fellow New Brunswickers in your thoughts and your prayers as you go about your day. I'd like to take a moment to recognize the work of New Brunswick pharmacists. March is Pharmacist Awareness Month, and I'd like to thank all the pharmacists working in our province for their efforts and the efforts they make to keep us all healthy, safe, and well-informed. For many years, pharmacists have played a key role in our annual influenza vaccination campaign. In the weeks ahead, we will be looking to them again to help us vaccinate as many New Brunswickers as possible against COVID-19. Our vaccine strategy will continue to shift to meet changing conditions. Il y a 2 semaines, nous avons annoncé que nous prévoyons vacciner autant de Néo-Brunswickois vulnérables que possible, et ce, aussi rapidement que possible. Notre plan, c'était de reporter la seconde dose de vaccin jusqu'à 90 jours dans le cas de certaines personnes présentent moins de risques. Cette semaine, le Comité consultatif national sur l'immunisation, qui donne des directives fondées sur des données probantes au gouvernement sur la stratégie d'immunisation, a émis de nouveaux conseils sur le vaccin contre le COVID-19. 2 weeks ago, we announced our plan to vaccinate as many vulnerable New Brunswickers as we can, as quickly as we can. Our plan called for a delay of up to 90 days for some lower-risk recipients to receive the second dose of the vaccine. This week, the National Advisory Council on Immunization, which provides evidence-based guidance to governments on immunization strategy, issued new advice on the COVID-19 vaccine, and the Council has determined that a gap of up to 120 days between the first and second dose of the vaccine is scientifically sound. This change, which is already being implemented in British Columbia and Manitoba, would enable us to get the COVID-19 vaccine into the arms of even more New Brunswickers in the weeks ahead. We will be revisiting our immunization rollout plan based on this guidance and going to Cabinet next week with a revised plan. The other change we are now seeing is in the vaccine supply. Shipments of several vaccines are expected to ramp up significantly in the next month. En mars, le Nouveau-Brunswick recevrait ses premières livraisons du vaccin d'Astrazeneca, dont l'utilisation a été approuvée récemment au Canada. Le vaccin d'Astrazeneca a l'avantage de ne pas demander un entreposage à des températures extrêmement froides, comme le vaccin à base ARNM de Pfizer ou les températures de congélateur nécessaires aux produits de Moderna. Cela nous permettra d'élargir la portée de notre campagne de vaccination. During March, New Brunswick will receive its first shipments of the Astrazeneca vaccine, which has recently been approved for use in Canada. The Astrazeneca vaccine has the advantage of not requiring ultra-cold storage like the Pfizer mRNA vaccine or freezer temperatures needed for the Moderna product. So this will allow us to broaden the scope and reach of our vaccine campaign. Vaccines are coming and will be available to everyone who wants one. With this new guidance on delaying the second dose and a steady supply of vaccines, it is my hope that we will be able to provide at least one dose to every New Brunswicker before summer begins. In the meantime, I ask for your continued patience. We do get a lot of questions about where people fall in the vaccine rollout, but again, if everybody is patient, we can tell you exactly that everyone will get a vaccine, at least one dose, prior to the end of June. Like everything else associated with this pandemic, the vaccine rollout process is challenging, but we will get there. We have now spent a full year on this COVID-19 roller coaster. The constant and dizzying changes in direction, with hope one day and sorrow the next, and hope again the day after that, have left many of us feeling weary and depleted. COVID fatigue is real no matter where you live, in this province, other provinces, other countries. And the impact that the COVID-19 pandemic is having on our mental health is profound, and it's not always easy to spot. The effect can be cumulative and may sneak up on you when you're not expecting it. Perhaps you've been having trouble sleeping, maybe you want to sleep all the time. You may feel weepy, emotional, without a clear notion of precisely why you feel this way. And you might find yourself feeling anxious, troubled, and alone. And trust me, you are not alone. Be aware that these signs in yourself and those around you. Reach out for help when you need it, because help is available to you. Check in with the people that you care about. Let them know it's okay to not be okay, and encourage them to talk about their feelings and to seek help when required. We have come so far, and the finish line is just over the horizon, but the journey is not over. So please look after yourselves and look after each other. We do need to prop one another up and give each other hope right now. We will get through this together. Nous avons parcouru bien du chemin. mais ce n'est pas fini. Prenez donc soin de vous et prenez soin l'un des autres. Nous avons besoin de nous soutenir et de nous donner espoir. Nous arriverons à traverser cette situation ensemble. Thank you. Merci.
Good afternoon. Bonjour. The last 2 months have not been easy. Following the holiday season, we saw a concerning rise in cases in many areas of New Brunswick. We have also been dealing with uncertainty after confirming the presence of the UK variant of COVID-19 in our province last month. During January and February, zones have had to move to orange, red, and even lockdown levels. This meant businesses had to close, travel between zones was restricted, and we were not able to spend time with many of our family members and close friends. But once again, our province has gotten back on the right track. New Brunswickers have done what was required to control outbreaks and slow the spread of COVID-19 by following the guidance of public health. Last week, we explained that if the spread of the virus remained under control, the entire province would move to the yellow alert level at the end of the day this Sunday, March 7th. COVID Cabinet and Cabinet decisions determined we will be moving to the yellow level on Sunday night at midnight. However, we are seeing an increased number of new cases in Zone 7, the Miramichi region, and we are monitoring this situation closely. We are doing extensive testing right now. If there is a significant change, we will revisit the decision, but currently, as of now, Zone 7 is scheduled to move to yellow along with the rest of the province on Sunday. I want to remind you that yellow looks a bit different now than it did the last time we were in this alert level. The new rules of yellow include a steady 15, which means your household bubble can increase your steady 10 by 5 additional contacts who may live in different zones. You may spend time in public with these contacts, including dining out in restaurants. Sports teams will be allowed to play within their league across zones following their operational plan. Tournaments or larger events within a zone may also be permitted, subject to approval of the plan. Formal indoor gatherings will be permitted with an operational plan in place as long as the venue is at 50% capacity or less, and physical distance can be maintained along with mask use. Formal and informal outdoor gatherings of 50 or fewer people will be permitted with physical distancing in place. The other rules previously associated with yellow have remained the same. You can find a full list of these guidelines at gnb.ca/coronavirus under Recovery Plan. While the website outlines the rules that are in place right now, we expect that they will continue to change, and public health restrictions will loosen as more people are vaccinated. As Dr. Russell mentioned, March is Pharmacist Appreciation Month, and I would also like to take a moment to thank New Brunswick pharmacists for the important work they have done throughout the pandemic. They have played a pivotal role in helping to administer flu shots to New Brunswickers in communities across the province, and by ensuring residents have had access to the medications they require. We are working closely with pharmacists now as we move forward with our vaccination rollout plan. We will have more details very soon about the role pharmacists and other healthcare partners will play as we continue to make COVID-19 vaccinations available to more people. I am pleased that the Astrazeneca vaccine has been approved by Health Canada and will soon be available in New Brunswick. We expect to receive 10,000 doses of the Astrazeneca vaccine in the month of March. This additional vaccine means we are looking at our vaccine rollout plan once again and considering adjustments so we can vaccinate more New Brunswickers in a shorter time frame. Public Health will participate in meetings with the all-party Cabinet Committee on COVID-19 and Cabinet next week to discuss what that will look like, and we will share that plan with you once it is finalized. As of February 27th, we have administered nearly 34,000 doses and more than 12,000 people are fully vaccinated. We are using the limited vaccine we have received to date and are continuing to focus on our priority groups, including the 11,000 residents in long-term care facilities in our province. 7,500 residents have now received at least one dose and 2,400 are fully vaccinated. We are also focused on vaccinating New Brunswickers' 27,000 healthcare workers. So far, more than 13,000 have received at least one dose, and more than 10,000 are fully vaccinated. Right now, New Brunswick is in a good place. Our vaccines are being administered as quickly as possible, and we are seeing a low number of active cases and low daily case numbers. But we still have to remain vigilant and follow the rules. We have seen how quickly things can change, both here and in nearby provinces, especially with the presence of the variant. Continue to do your part to protect yourself and everyone around you as we move to the yellow alert level. That means wearing a mask in indoor public spaces, maintaining a safe physical distance from others, and getting tested if you have any symptoms. If you live in Zone 7, the Miramichi region, please take Dr. Russell's advice and get tested today or tomorrow, even if you aren't currently experiencing symptoms. Contact tracing at this point appears to indicate the cases in Zone 7 are linked and the contacts have been notified. But with the presence of the UK variant, we want to be sure that no additional people have been exposed, and conducting mass testing will help us make that determination. I'm proud of all New Brunswickers for doing their part to keep the virus under control as quickly as possible. Let's all show the world that New Brunswick continues to be a leader in the fight against COVID-19. Thank you. Merci.
Thank you, Minister Shepherd. Dr. Russell, merci beaucoup, Minister Shepherd et Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question and a very quick follow-up. You have the right to pose your question in the official language of your choice. Please remember to ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Andrew Cromwell, Global News.
Thank you, Bruce, and hi to Dr. Russell and Minister Shepherd. Just wondering, whoever is able to answer this question, is there a rough timeline when pharmacists will be able to administer the dosage of for COVID-19?
We should have that information next week.
Next week? Okay, thank you.
Do you have a follow-up, Mr. Cromwell?
No, thank you.
Jennifer Bassa, CTV.
Good afternoon. There have been some different estimates given on how many people can be vaccinated per week in the province. We were wondering, why is that the case?
Well, I'll take that. I think it's just a matter of anecdotally speaking to it from time to time, and so to be more accurate, I think we have confirmed with our department that during flu season, the utilizing our pharmacies and many other avenues, physicians and etc., and our public health resources, we can do about 40,000 vaccinations a week. So I think we'll stick with that number from now on for you.
Do you have a follow-up today, Ms. Bassa?
No, thank you. I'm good.
Vicky Hogarth, CHCO.
Thanks, Bruce. This question is either for Dr. Russell or Minister Shepherd. If the vaccine doesn't provide immunity to the virus, but instead lowers the severity of symptoms if infection occurs, do you think the term herd immunity is still accurate with regards to COVID-19, or should it be removed from discussion? Can we ever really have herd immunity?
I hear what you're saying, Vicki. I think the point of the vaccination rollout across the country and indeed globally really is around reducing hospitalizations and deaths. The immunity that you can get naturally from having been infected by COVID versus the type of immunity that you can get from the different types of vaccines, and they all confer different types of immunity. I think there still can be room for herd immunity to be part of that language. But again, we will be closely watching what happens over the next several months as the variants of concern play a role in continued transmission. And indeed, in some provinces in Canada already, 30% of the cases are already variants of concern at this point in time. So I think the trajectory of how quickly we can get people vaccinated with one dose and trying to stay ahead of the variants in terms of outbreaks and again, trying to protect our vulnerable populations is our priority at this point in time.
Ms. Hogarth, do you have a follow-up today?
Yes, I'm just wondering if out-of-province family members or property owners will be permitted in New Brunswick with a 14-day quarantine plan in the new level, the yellow level.
We're not going there yet. That will be a further development later as we proceed through the, through the variant.
Jean-Philippe Hughes, Radio-Canada.
Oui, ma question est pour la docteure Russell. Hier, le Premier ministre parlait d'une vaccination à la population en général à partir probablement du mois de juin. Avec l'autorisation aujourd'hui du vaccin de Johnson & Johnson, est-ce que vous pensez que ça pourrait encore accélérer la vaccination de la population en général?
C'est difficile à dire, mais l'information que j'ai reçue sur ce vaccin et le nombre de doses qu'on va recevoir au niveau national, ça va pas être dans les prochains mois. Alors, ça va être plus tard.
Monsieur Hughes, as-tu un suivi?
Oui. Hier, dans la clinique de dépistage massif à Miramichi, il y a environ 500 personnes qui ont été dépistées. Est-ce qu'aujourd'hui, ces 500 personnes, on a les résultats compris dans les cas que vous nous annoncez? Il y a des tests qui ne sont pas encore traités.
Alors, hier, on a fait en total 900 dépistages, environ 500, je m'excuse, 700 quelque chose pour les gens qui étaient asymptomatiques et environ 200 pour les gens qui avaient des symptômes. Et alors, en total, c'était 900 dépistages et échantillons. Et les résultats qu'on a reçus, qu'on a annoncés aujourd'hui, ça inclut probablement entre 200 et 300 de ces tests. Alors, les autres résultats, au fur et à mesure qu'on les aura, les résultats de ceux qu'on n'a pas eu hier, ça serait ce soir qu'on on va les recevoir. Et ceux d'aujourd'hui, ça va être demain. Et ceux de demain, ça va être dimanche.
Merci.
Merci, M. Hughes. Simon Delatte, l'Acadie Nouvelle.
Oui, ma question est pour la Dr. Jennifer Russell. Je voudrais savoir si, suite à ce passage en phase orange, on peut espérer par la suite un relâchement des règles aux frontières, notamment avec le Québec et la Nouvelle-Écosse, et à partir de quand?
I'm going to take that question, if you don't mind. So as all of this evolves, it's important that we look at the data and we look at the risks that we're trying to mitigate. So we will be looking at Quebec and the the restrictions that we have there, but there won't be any changes, certainly in the coming couple of weeks. It will be brought before the COVID cabinet, COVID committee, all-party committee as we proceed, and with public health's guidance, we will be making that determination. But for now, there are no changes.
Merci. Simon, as-tu un suivi?
Oui, rapidement, les 70 ans font partie du dernier groupe qui sera vacciné, le dernier groupe prioritaire qui sera vacciné au Nouveau-Brunswick. Est-ce que c'est pas contradictoire avec la stratégie fédérale?
So we have always said that our vaccination strategy is based on supply and in consultation with public health, and presenting it to the COVID Cabinet All-Party Committee and Cabinet. I've also said that if supply was in excess of what we were expecting, the conversation is kind of moot because we want to get everyone vaccinated as soon as possible. So we will be presented with a new strategy next week. We will be considering all of the options that are put before us, and we might expect changes next week as, different from what we have put in the past. But our strategy has always been based on supply. And now that we have more confidence that we have more supply, that may change.
Thank you, Minister. Monsieur Hughes, Dr. Russell a quelque chose.
Oui, juste pour corriger les nombres de gens qui ont été testés hier dans la zone 7, c'était 776 gens sans symptômes et 135 qui avaient des symptômes. C'était 901 en total.
Merci, Doctor. Nathan DeLong, Miramichi leader.
Good afternoon. My question is for Dr. Russell or Minister Shepherd, whichever one can answer. In the event that there is a setback in Zone 7 this weekend following the continuation of the mass testing clinics, and that move to yellow is delayed in Zone 7, when would be the earliest that Zone 7 could go back to yellow? That's in the event that the move is delayed.
These things are really hard to predict. As you've seen in other outbreaks in other zones, Zone 5, Zone 4, even Zone 3, 2, and 1, it varies from a week to 2 weeks to 4 weeks or longer. So it's just really based on how fast the cases numbers go up, what types of settings they're happening in, if there are vulnerable settings like nursing homes, et cetera, involved. So we take all of these things into account when we're trying to get things under control and how quickly the contacts can be traced and again, how well we can stay ahead of this. The variant does transmit very, very quickly. We do know that people were contagious before the March break and the contact tracing that we were done. So we are strongly encouraging people to not travel in and out of Zone 7 if they can avoid it at this time, only because, again, we know that prior to the March break, there were people that, based on the contact tracing, were contagious in that area.
Thank you, Dr. Mr. DeLong. Do you have a quick follow-up?
Yes, I do. Are you able to clarify if the cases included in today's update or news release at Miramichi Valley High School and the Miramichi Education Center were counted in today's case count update?
No.
Okay, thank you.
Harry Forstall, CB.
Thank you, Bruce. Dr. Russell, we're hearing of cases where people are jumping the queue to get a shot, getting so-called wastage shots in contravention of the directions contained in the vaccine wastage at clinics document. Who's watching this, and what are the implications for, say, a 40-year-old getting in the lineup and getting a shot?
So first and foremost, it would be very problematic if any doses were wasted. And all of the clinics do have a list of priorities with respect to if any of those doses are going to be going to people that aren't included in the intended population of a clinic. And so there is a list that they do need to stick to. They do consult with public health on those lists, and to my knowledge, I haven't heard of anybody jumping the queue unnecessarily or without being part of the priorities that were agreed upon with public health.
And just to contribute to what Dr. Russell is saying, we have certainly been in touch with associations and every mechanism by which these doses are being delivered, and emphasizing that it is imperative that they stick with their lists and they do everything possible to ensure that the vaccinations are being given to the priority groups.
Mr. Forstall, do you have a follow-up today?
I do, Bruce, thank you. What happens if Zone 7 turns out to be a new outbreak? In other words, will Zone 7 possibly face being shut down on its own, or is there the risk that the whole province reverts to orange again from yellow?
Well, Harry, we are going to be watching very closely over the course of the weekend as those test results come in, what's happening. So in Zone 7, that is our biggest concern. But as I mentioned, there were some people who were contagious prior to the March break who may or may not have traveled outside of the zone. So I will be concerned about cases popping up anywhere and everywhere in this province in the next several days. And obviously the cases that have now tested positive in Zone 7, all of their close contacts will be self-isolating, and we'll be waiting to see if any of those turn out to be positive in the end. So we have some work ahead of us, and we'll be closely monitoring and having discussions based on those results as they come in.
Thank you.
Thank you.
Meg Cunningham, CHMA.
Good afternoon. Dr. Russell, how does the approval of the Johnson & Johnson vaccine, which takes only one shot rather than two, impact the pace of vaccination in the province? And how do you determine whether someone gets the one shot versus one that requires two shots?
Well, my understanding is those doses aren't actually going to be available until much later. So it's by that time, most of the population will have already had one dose. But again, we'll have to keep discussing as the information comes in, because this is, we've just received this information recently. So we'll keep evaluating. But again, my understanding is those doses won't be available to New Brunswickers, well, to Canadians, until very late in the year. So again, by that time, most people in the province will have already received at least one dose.
Thank you, Dr. Ms. Cunningham. Do you have a follow-up?
Yes, unrelated, but should New Brunswick move to yellow, can we expect a border arrangement with neighboring provinces to be on the table?
That would still be under discussions, and I know that right now I don't think that Nova Scotia, PEI, and New Brunswick are really considering opening the Atlantic bubble. It is certainly our goal, but that will be a conversation between the premiers and between public healths of each province.
Thank you. Eloise Rodriguez, Radio-Canada.
Oui, Dr. Russell, un peu pour rebondir sur cette question, j'aimerais savoir ce que ça prendrait concrètement pour que vous recommandiez l'ouverture à nouveau de la bulle à santé. Qu'est-ce que vous voudriez voir comme critère pour recommander ça?
Je peux dire que ça, c'est des discussions qui vont être évaluées sur l'information qu'on recevrait sur les nombres de cas, le pourcentage de cas qui sont des variants, puis le rapportage de ces cas tout alentour du pays vont changer, parce que vraiment, quand on voit le pourcentage les cas de variants augmenter au point que ça va être plus élevé que l'autre sorte de COVID-19 qu'on a vu déjà. Ça va être vraiment dans le contexte aussi de quel pourcentage de la population est vaccinée. Alors, avec toute cette information, on va continuer à avoir des discussions, mais c'est difficile à dire à ce moment-ci avant qu'on voit un plus grand nombre de gens vaccinés, en même temps qu'on espère qu'on peut continuer à réussir à contenir le virus COVID-19, le variant et les non-variants.
Merci. Mademoiselle
Merci.
Rodriguez, as-tu un suivi?
Oui, rapidement. J'aimerais savoir quand est-ce que les personnes qui vivent à la maison de 80 ans et plus pourront commencer à recevoir un vaccin, et comment expliquer que le Nouveau-Brunswick est la seule province en Atlantique qui n'ait pas commencé la vaccination pour certaines encore.
Well, again, we've been working with our priority groups, and supply has dictated how we move forward. As I've stated earlier, public health and the task force for distributing vaccination will be coming to the COVID Cabinet All-Party Committee and Cabinet next week with a proposal. And then we'll be able to share more information with you at that time. And also let me say that information on the vaccine rollout has changed, I think, a few times even here in New Brunswick as supply has become available. So each and every day that information changes, we rely on public health and the task force on vaccination rollout to keep us apprised, and we make those decisions accordingly.
Merci, Mademoiselle Rodriguez. Thank you, Minister. Marie Sutherland, CBC.
Good afternoon. My question is for Minister Shepherd or Dr. Russell. With 3 vaccines soon to be on offer and a 4th later this year, and with some significant differences in their efficacy rates, will New Brunswickers be allowed to choose which vaccine they want to be given?
Well, I'll take a stab at this, and if Dr. Russell thinks I'm lacking, she can help me out here. But the fact is that right now we know that our major supply is with Pfizer and Moderna. Astrazeneca we have coming online 10,000 this month. So at this time we will be strategically using our vaccines to our priority groups and targeting groups. So I think right now that question is kind of still up in the air because of supply.
I do. This is for Dr. Russell, or could be for Shepherd. 2 weeks ago, Public Health confirmed a 5th case of the variant, but to my knowledge, we've not yet heard which zone it was identified in. We've identified the zone all of the other variant cases were found in. So I'm just wondering why we're not being told where this 5th case was found.
Not sure why it hasn't been publicly stated, but it is Zone 7.
Thank you. Tom Bateman, Brunswick News.
Good afternoon to you both. First, and kind of building off that last answer, maybe, what is the origin of the Zone 7 outbreak or cluster of cases?
Travel related.
Can you say travel from where?
That's the information that I've been provided, so that's what I'm providing to you at this moment. That's what I have been told.
Have a follow-up, Mr. Bateman?
Yes, I do. I'll not ask about the rollout of the vaccine plan until next week, but I wonder if either of you can speak to how you and your colleagues are being lobbied or petitioned in one way or another by various groups, kind of looking at prioritization or reprioritization. Now there's more latitude or supply in vaccines. I can see, how many people would put their hands up to be considered, for this wider supply. Thanks.
I can share that there has been some, but in all honesty, it's been extremely respectful. There has been, questions about, people with disability, people in certain age groups. There has been some, some asks, but nobody has said, I need to be in front of somebody else. And so it's been a very respectful process, and I'm more comfortable now knowing that our supply is going to be consistent, and we know that everyone's going to be moved up, and we're saying quite confidently now that everyone can receive first dose by the end of June. So I think that's taken away a tremendous amount of anxiety. Here we are in early March, knowing that in 3.5 months ish, we are going to have everyone with their first dose who wants it. And thankfully, we're receiving lots of people who want it, and they're going to be ready. So that's a really good thing.
Thank you, Mr. Bateman.
Maria Vassono.
Oui, bonjour, c'est pour la docteure Russell. Suivant les assouplissements pour motif de compassion aux frontières, est-ce qu'un proche aidant qui vit, par exemple, à Pointe-à-la-Croix peut maintenant de nouveau traverser à Hamilton pour prendre soin d'une personne qui est en perte d'autonomie?
Applications can be done through public safety with requests for compassionate visitation. We are doing everything we can to ensure that we're able to, give positive answers. But we have a committee, shall I say, with public health and public safety, who review those requests, and they, they are given every consideration.
Mademoiselle Arsenault, as-tu suivi?
Donc, si je comprends bien, c'est du cas par cas selon la situation.
Yes, you're correct.
Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell, and it's a question about rotational workers. Farmers have concerns that the rules are different from last year, that workers will be entirely alone for as many as 20 days, and that employers who invested last year in new facilities to isolate new arrivals will not be able to use those facilities, and that the additional cost could be as much as $5,000 per worker, and adding significantly to the cost of food production. So what's the government's response to farmers' concerns?
So if it's a government question you're asking, those parameters are still being defined with public health and with public safety and with the industry. So I don't really have a clear answer for you today on that, but we'll try to get back to you next week with that.
Ms. Fraser, do you have a follow-up?
Yes, I do. This question is for Dr. Russell. Do we have any results from the walk-in testing clinics in Miramichi yet? Were there any positive cases found, and how many of today's 900 and I believe it was 929 reported tests were conducted there?
So yesterday we did 776 asymptomatic tests, 135 at the assessment center for a total of 901. But my understanding is the results so far are less than, we haven't gotten results for all of them. We'll get all of them tonight, but the ones we got back so far were negative.
Thank you, Ms. Fraser. Jennifer Bishop, Brunswick News.
Hi, my question is for Minister Shepherd. The Rotary Club of Bathurst has played a role in vaccine rollout in care homes in the Schiller region as authorized vaccine receivers. How did service groups and volunteers get involved with this? Are they helping provincially, and will volunteers be used in similar capacities as we move through the phases of the vaccine rollout plan?
So, for sure, we are looking at every opportunity to use, to use our service groups and their resources that they have. And that could be Rotary clubs, could be legions, community centers. So we need to maximize every opportunity that we can. And so I can't say that any one specific group will be taken over another. It will be location. It will be strategic use of those resources as public health and our task force vaccination rollout team see fit.
Ms. Bishop, do you have a follow-up?
Yeah. So I guess just to clarify, will these groups and volunteers be used provincially, and are there any specifics on what other types of roles these volunteer groups will play moving forward?
So, this will be really about location. And so the task force vaccination rollout team will decide what locations what areas they need to provide. We're going to look for accessibility, I would assume. And so I would just suggest that if organizations if they've reached out to us already, we would have provided that to the task force rollout team. And if they haven't told us that they want to be a part of it, please do send us an email, contact public health. You can send it through me. We will make sure that the team knows about it. Not every place is going to be selected, of course. It will be about strategically choosing resources that we need at any given time during the vaccine rollout.
Thank you, Ms. Bishop. Alexander Silberman, CBC.
Good afternoon. This question is for Dr. Russell. Many New Brunswick universities are currently deciding how they'll operate for the fall semester, and some are planning to continue holding some courses online, or at least a portion of them. What public health restrictions do you expect campuses will have to operate under this fall, and what is public health recommending they plan for at this time?
That's very difficult to comment on at this time because it really will be based on the percentage of the population that's vaccinated and how well that protection is controlling outbreaks, et cetera, of COVID-19.
Mr. Silberman, do you have a follow-up?
Yes, based on the current plan for vaccine rollout, what public health measures do you expect will still remain in place at that point in time?
Well, again, I think because we still are waiting for more data on everything that's happening right now, all I can say is that the measures that are in place right now will continue until we're confident that we no longer need them. And that will be based on, again, the percentage of the population that's vaccinated with 2 doses, as well as what we're seeing in terms of transmission, even with vaccination.
Thank you, Mr. Silberman. Merci beaucoup tout le monde. Thank you, everybody. That concludes today's update. Merci beaucoup.
That concludes today's COVID-19 update for New Brunswick. For anyone who's joining us late, I'll just give you a lowdown on the numbers. There were 4 new cases today. 1 was in Zone 3, that's the Fredericton region, and 3 were in Zone 7, that's the Miramichi region. That means there are 33 active cases now in the province, which is down 3 from yesterday at 36. Before I get to the breakdown of the zone count in terms of active cases, the big news we learned today, for those just joining us, is that as of March 7th, this Sunday at midnight, the whole province will be rolling back to the new modified yellow level of recovery. So instead of just a steady 10, there's now a steady 15. I did post, if you're watching on Facebook, in the chat bubble, I posted a link to the new yellow level guidelines. I did ask, though, on behalf of many of you who wrote in wondering if the new yellow level will mean that out-of-province family members or property owners can now come with a quarantine plan, but it's still not in. With the new variant at play, Minister Shepherd answered that question and just said, no, that's not in the new yellow level of recovery at this time. But as we know, these things are adapted depending on where we're at in our recovery. So give it a few more weeks, months, who knows, but they will continue to update what the yellow level means as we deal with the new variant and as the vaccine rollout happens. Another thing we learned today is that there are 10,000 doses of the new Astrazeneca, the newly approved Astrazeneca vaccine, coming to New Brunswick this month. That'll change the rollout, but they will be doing a revision in terms of the vaccine rollout that they'll be giving us next week. And a lot of that, I imagine, will deal with the fact that Astrazeneca, it's geared more towards, as we're learning, people under 65. So how that affects rollout if we're getting 10,000 doses in March could really change things. I'm not sure what that will mean, but we'll keep you updated when that update is available. It'll be sometime next week, though. If you heard at the beginning of the conference, Bruce McFarland, the moderator, did mention for all the journalists to stay on hold this weekend. There could be an update this weekend. Now, this will likely have more to do with the Miramichi region. That's Zone 7, where there was a confirmed case of the variant this week, and there is mass testing going on right now. It was mass testing yesterday, mass testing today. Now, what that could mean is, in terms of the whole province going yellow, if they do find there are a larger number of active cases currently in Zone 7 than we think right now, then they could potentially not roll back with the rest of the province. That's something that will be decided over the coming days, and as we get results from spring break, if that means if spring break had any effect on the case count in New Brunswick. So in terms of active cases, as I mentioned, we have 33 now, which is down 3 from yesterday at 36. In Zone 1, there are 4 cases. That's down 1 from yesterday. Zone 2, there are 0 cases. Zone 3, there are 3 cases now active. There were only 2 yesterday. Zone 4 is down to 16 from 22 yesterday. Zone 5 and Zone 6 both have 0 cases. Zone 7 is up 3 today. They had 7 yesterday. Today they have 10, and they obviously have their eye on Zone 7 just to see how things will pan out over the coming days. I appreciate you watching with us here at CHCO Television. I'm Vicki Hogarth. I'll join you next time, and I'll keep you updated on Facebook when the next update will occur. Thanks for watching.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.